What you need to know about Medicaid. Medicaid is the United States' largest public health insurance program, and it provides access to health care and long-term care for over 68 million Americans. Now, Medicaid will provide services for prenatal care, checkups for children, and treatment for low-income adults and people with disabilities. In fact, 50% of Americans with disability will receive long-term services and support known as LTSS. Now, Medicaid benefits are going to vary depending on where you live. And not only will the benefits vary, but your eligibility is going to vary based on, again, where you live. That's important for you to understand because under the Medicaid statute, states are required to provide coverage to most low-income older Americans and those with disability. But each state can choose to extend that coverage to provide other benefits. And those benefits can include things such as dental and vision services, and can even provide home and community-based services to assist with activities of daily living. And those can include bathing, toileting, dressing. Now, the Medicaid statute requires that a state also provide nursing facility care for those who are eligible. But states are not required to provide for home and community-based services. Work requirements can vary from state to state. Now, some states are beginning to require that recipients of Medicaid work and then pay a portion of their income towards a Medicaid premium. It should be remembered that those who are eligible for Medicaid are working generally aren't earning a living wage to begin with that would even allow them to pay the premium. This is clearly an attempt to reduce Medicaid rolls without providing any alternative means of health care coverage. Now, some states are requiring that a recipient of Medicare work even if they are disabled. Now, most people I've encountered in my law practice handling Social Security, disability, and ERISA claims would love to work. They don't want to be disabled. And it remains, in my view, to be seen how people who are disabled and unable to work will still be able to maintain their Medicare eligibility and obtain medical care. Obviously, these are significant concerns, and these attacks unfortunately seem to be based on Republican attempts to reduce, as I've said, the Medicare rolls. And now Republicans are fixed on ways to reduce federal funding. And one of the targets is to cut the Medicaid benefits, taking away people's health care, gutting Medicaid and the Affordable Health Care Act. I think that's awful and cruel. If you really want to fix the budget, the solution is simple. Reenact all those Trump tax cuts that were given to corporations, reducing federal spending on the backs of low-income Americans and disabled Americans just isn't the American way. Call your legislator and complain, but more importantly, during the next election, vote for somebody who is going to maintain Medicaid benefits, those for low-income individuals and disabled individuals. If you have any questions about your rights to Social Security, call me today at 727-894-3188 for a complimentary consultation.